FastCast. Weird healthcare ramblings. Posit. Insurance, by its very nature, is undemocratic. It's always occurred to me, as long as I knew what insurance was, that insurance was essentially capitalized communism, right? I mean, I think we can all agree on that. It's let's all pay into a thing on the assumption that we're not all going to need it. And instead of having it be the government, it's some private company. And the problem, of course, is that the profit motive gets in the way of that. And what I mean when I say it's undemocratic is that, like, follow this thought experiment with me. The invisible hand of the free market, which I absolutely agree is a real thing. I'm not a complete, no free markets, I just think there are some things that are either too important or too tricky for a free market to effectively work on. And I think insurance is one of them, specifically health insurance. Because the whole idea of what this House bill is trying to do, at least one of the things, is remove the requirement, meaning some sort of regulation that interferes with the free market, that insurance companies cover people with pre-existing conditions in the same way they cover other people. And so what this means is that the insurance companies will, as a result of their fiduciary responsibilities to their shareholders, start trying to find ways to minimize risk. And the way that they will do that is force people with pre-existing conditions to pay more for healthcare. If you let this system finish itself, all you're going to get, well, it'll happen in stages. First, you'll get the really high-risk people off, and then the insurance companies will only be insuring low-risk people, and then they'll start making more profits. And then eventually, the numbers, the actuarial tables, will basically have it such that the only thing that those people are being covered for, and I'm talking about long time horizons here, eventually, the very, very healthy people will remain healthy, and the rest of the people will just get sicker and sicker. I'm not saying it would definitely end up like the Time Machine with the Morlocks and the Eloi, but on really long time horizons, it kind of does. And that is what I think it comes down to, is that this debate is about whether you think healthcare is a product to be sold or a basic human right. And I understand that there's disagreement on this, but the people who think it's a product are wrong. So here's hoping it dies in the Senate, which I'm sure it will, at least in its current form. FastCast Healthcare, see ya! Hey, thanks for watching the FastCast. If you like what I do here, don't forget to like, share, and subscribe. You can also follow me on Twitter at Mr. J Handle. And remember to check back, because I do this a couple times a week. Thanks a lot, everybody. FastCast!